Hey there, Dr. Oz and USANA. My name is Zoe Talley and I'm entering your nursing contest. Nursing is one of the most challenging and important professions of today. Nurses put their personal lives on hold to give their energy to their passion for healing. This passion is dying in America today as many individuals complete nursing schools just looking for a paycheck. I wish to break this stereotypical standard as I want to show my patients that I actually do care. Nurses should be selfless servants who work long hours for the benefit of their patients, first and for themselves and then for their families second. Nursing means being a light in the darkness for patients, showing them that even if they have no one else, the nurse will be there for them. Ever since I was a little girl, I had a passion for creating comfort for those in discouraging situations. I attribute this passion to the example that my grandmother provided for me. My grandmother was a true superwoman. She worked full-time as a nurse at a local hospital and raised 3 kids and then later raised me. She began working for Highland Medical Center in Scottsboro, Alabama as a striper nurse at the young age of 15. What an inspiration. At the time, a small community college nearby, Northeast Alabama Community College, was developing their first nursing program. My grandmother was offered tuition for nursing school by the hospital, and she quickly began night school at the community college. After becoming an RN, my grandmother worked for over 50 years for this hospital and retired while I was in high school. Sometimes she would bring me to work with her after school was over so that she could complete her paperwork for the day. It was at this time that I became curious about the medical field. I wanted to care, give my all, and comfort those who need it most, just like I saw my grandmother do. I became interested in anesthesiology and began to ask questions about the anesthesiologist's job at the hospital. My curiosity led me to shadow the CRNAs at Highland Medical Center for a day and to observe 7 different surgeries in one day. Mind you, I was only 15 years old at the time. I was eager to help transport patients and watch the surgeries closely. I asked many questions and determined that a CRNA is what I was born to be. When I started school at the University of Alabama as a pre-nursing student, I eagerly signed up for classes, excited for the new things I was going to learn about medicine and the human body. After completing my sophomore year at UA, I felt a desperate need to offer more to the world and get a taste for the nursing field. A study abroad company called Lead Abroad was coming to my school to recruit students to accompany them to Costa Rica, where they were holding free clinicals. Reading about the doctors, pharmacists, and translators I would be working with further strengthened my longing to go and serve. I was not prepared for the emotional journey that would ensue. Because of Costa Rica's poor healthcare system, the clinic we held was filled with patients that could not even afford to go see a doctor for an earache. Taking vitals and giving these patients medical advice really humbled me and further fueled my passion for the field of nursing. I came to touch lives, yet they touched me more. I want to be a nurse because I want to help more people like the people I met in Costa Rica. In January, I will begin my classes at the UAB School of Nursing in Birmingham, Alabama. If I were to receive the scholarship, I would be able to continue my education. As I am an independent student, I am paying for college on my own. Nursing school is a large financial burden that would be greatly alleviated with the assistance of this scholarship. My passion for nursing will not stop me from doing what it takes to find a way to pay for school. My goal is to graduate with my BSN debt-free. Crazy, right? It would be a great honor to be selected as your scholarship recipient.